So let's come to the point. So how the Ramesh started and how you guys would be doing it. History of presenting complaint. She said me jerky movement. First of all, she said, okay, I'm here to help. I understand from your notes, you got jerky movement, you got fitting. Tell me more about the open-ended questions. She started with that. So then the next part was before, during, after. She would have asked two to three questions, not more than that. So if I was Ramesh, I would have asked, okay, Michael, can you please tell me what you was doing at that time? Anything specific happened? Two questions. That's it. During, before that. That is the before. And during, do you remember everything during? No, doctor, I don't remember. By any chance you wet yourself or spoiled yourself? Any tongue bite during that? No. Okay. After the incident, was any tongue bite? Was any tongue bite? Do that episode was witnessed by your wife? Yes. Okay. Did your wife told you that you are confused? Is this happened first time? By any chance anyone recorded video of that? Who witnessed that? Do you remember everything? You can ask. By any chance you banged your head? By any chance you remember you lost your fainted? So Ramesh can ask straight away, did you fainted? Then do you know hardly how long? Okay, so it's a very common thing. So you can ask those things. So Ramesh, you tell me what point here you think could have improved in the history part?
I didn't ask about the head injury.
Yes.
Any video thing. I didn't ask that your wife make any video of you.
Okay. And did
I
it happen
asked
first time? Did
what
you
did
ask
your
about?
wife do?
Did you ask about that? Did it happen first time?
Yes, maybe I asked this.
Yes, maybe you have asked. I don't remember.
Yes, I asked it.
Okay. DDs. The first red flag you would be asked. Right? She did ask about arm weakness. You could have asked about slurry speech because I have to rule out fits when you are in any setting. It's a hard situation, guys. I'm telling you. If somebody is coming with a stroke, and I'm not going to call stroke regs, and I don't document the name, trust me, heartbeat will, because this is a dangerous situation. You need to rule out stroke first. Because if fast is negative in the A&E setting, if fast is positive, I won't be a good clinician if I don't speak to the stroke reg. I have to make sure weakness, slurry speech, any weakness of arms or legs. Okay. Any fall or bang your head, ongoing stress, we can ask, but not here. Fever, problem with the light, neck pain, meningitis, any rash, do you feel sick? Early morning vomiting mean that by any chance do you have any trauma? Oh, sorry, tumor. These are the few DDs you can ask. I ruled out stroke, that's fine, you done it. Problem with the walking balance. Why I'm talking about the balance and walking, Ramesh? Because I want to rule out posterior stroke as well. Yes. Along with the fits, because there are two things which I'm ruling out: the fits, infections, fits, infection, stroke. That's it. Fits, infection, stroke, infection, meningitis, fits. Yes, I have to rule out. Why? First, I have to rule out stroke. If it's not stroke, I'm not worried now because first 50% of people might have, but I'm not doing as an A&E physician. I'm not going to do anything now. That can be done in the first fit clinic. But now, if it's a stroke, I have to do something. Ramesh, you happy with that? So these are the things which we can improve on. Moving to the next part. Yes, so if the fit don't need to be for the para. Zubda, that's a good question, but the thing is your history will be flexible. If something happens like bang, fit, dizzy, always start with the incident history. We added incident history. So you will ask or the para flexibly, but not here is incident history. General background, that is thinking about your general health, signposting, non-allergies. You can ask about blood thinners because somebody fitting might have band head. Or you can ask family history of, not migraine here, you can get the family history of high blood pressure or family history of, what we call it, stroke. Oh, sorry, epilepsy. Here you need to ask epilepsy, I will update it. Epilepsy. Okay, what do you do for living? Is this important to ask? You asked about my job, Ramesh.
No.
Yes, might be I'm working on the 5th floor, 6th floor, 7th, 8th floor. So I told that you need to ask about job to be a safe doctor, especially in the fits, because someone working with machinery, working on 5th floor, 6th floor might have risk of falling. Okay. Now coming to signposting, diet, excess smoking is important related to the stroke as well. Alcohol is, you can ask. This is not important. Not important at all. Epilepsy, asking epilepsy is important. Idea, Ramesh done well about asking idea concern, but still it can be improved. Anyway, now coming to the examination, should we do ECG? Will you do ECG in the A&E setting? In the A&E
Yes.
setting, we will see the ECG. Will we do CT head?
Not
In
at
this
the
way?
moment.
Sorry?
Not at the moment. We
We
are
will do,
going to refer the
we
patient
will
to.
do the CT head. We will mention that.
All right.
Okay, I'll show you the guidelines from my A&E hospital, and in every case where I'm suspecting, like he given you a lot of findings of it. You have to do the CT. You have to do the full seizure profile, which would include everything: electrolyte, calcium, magnesium, everything. You'll tell that in management part. Yes, you will do the ECG. You will do the CT. You will. Why you do the ECG? You might have some finding in ECG. Okay, and anyone know why we do the ECG? Because even someone's young one is coming with the funny tongue, faint they might have some finding on the ECG. So how would you explain first figure? It's a jerky movement of the body, often caused in never found in 50% of people. Sometimes we don't find the cause of the move. 50% of people never have another episode as well. But further investigation is required. Don't worry at the moment you are at the safe place. What I would do now, how to explain now. You will say that I'm going to refer you to the first fit clinic. You will mention that in UK there is first fit clinic. I'm going to refer you to the first fit clinic. I will write them letter now. They will get back to you in 1 week time or maybe 2 week times. They will going to see you, and they will might do other special tests. Or if the suspicion is not very high, you might not do the CT scan. But if the suspicion is very high, like in this scenario, you will do the CT scan because the patient come up with proper neurological symptoms, what he has told you. So you might do CT scan in the A&E setting. But if you're not doing CT scan in the A&E setting, you will say they might think of doing further investigations. Neurologist will see you and reassess your first seizure 2 weeks. Will reassess your first seizure at least in 2 weeks. You will get a letter in 1 week time, and they will see you in 2 weeks. Neurologist will see you and reassess you first seizure clinic. You may have further investigations, and if epilepsy is suspected, treatment option will be discussed with you. But you will tell them hope that 50% of people don't have any second fit at all. Advice: first seizure leaflet until being seen by clinic. Please, Ramesh, you didn't tell me that. Please inform DVLA. I told you that being IMG doctor, we always forget about that. Because if you don't do that, you might lose 1 or 2 score in management. Might be they put 3 score for DVLA. Might be 2 score for DVLA. Because it's a safety netting advice. Patient go outside, your doctor didn't tell you not to drive, he had another fit, he bumped into the school bus. What would happen? You getting my point? Why DVLA is very important. So DVLA is important, and not to drive until they have given you permission to do so. This may depend on advice from specialists. So first aid: inform family and friends, relative to keep you if happen again. Safe place, put you in the safe place, call for help. If it's greater than 5 minutes, try to make a video of it. Always keep you calm, remove from dangerous objects around you. Safety net, follow up. So follow up would be that don't drive, don't take bath, take shower, not go to hiking. I told you I love swimming and everything. Yeah. So that's fine. So Ramesh, are you still here?
Yes, I'm here.
Okay, let's do it one more time. And this time you will debrief me. We got the sketch, and according to this, guys, you are going to score me on the basis of the. So I've given you score criteria now. Okay, you need to score me, and if it goes well, and what I would do, if it goes well, what I would do. Okay, sorry. But overall, your consultation was very good, Ramesh. But always there is some like these things I learned when I went to the A&E. When I was doing consultation about the first, I had a lot of questions about first fit. But these are the things which I got to know when I was in the setting, how it goes and everything, what is most important. And I went through this pressure situation, kept asking my consultant, and I got to know that first fit, how we do that. So there's always a room of anyway. This is your time. You'll do it critically. My consultation now, and after that there's another one, we'll do it, and let's do it. So you technically, let me score Ramesh now. IPS while I'll give 3. Data gathering, she skipped 2 things. So I won't go very hard on her. 333 DVL she missed on. So management, I didn't like management. So 3368. 8. So I want to show that how I'm scoring on. You agree with that why I given you 2 in management? Because you missed DVLA, you was rushing, you get less time, so you could not able to manage time. So your history taking was too long. And
Mhm.
well done, Ramesh. So you passed this scenario again, even passing your PLAB too. So we'll do it now. We'll do it together. So remove pin. So well done. So my name is Michael Brown. Sorry, your name is what is your name? Lita Brown. Okay, and you having the same story. I'll try to
Okay.
do it. Let me get the timer on. And who is going to debrief and score me? Dr. Mariam, Dr. Zubda, Dr. Yumon, Dr. Hasham. You have to score me, and literally you have to write down the score, whatever you're scoring. Dr. Noor as well. So I want you guys to score me and tell me what mistakes I've done, because when you are performing it in 8 minutes time, definitely you will make mistakes. So just give me 1 second. Okay, so let's start now. Hello.
Hello.
Hello, I'm Dr. Gafar, one of the doctor here in A&E. Is this
Hi,
Lita
doctor.
around?
Yes, doctor. It's Lita.
Hello, Lita. I'm here to help you. I understand from my notes that you came to hospital with an ambulance. Is that okay? Is everything okay
Yes,
with you?
yes, doctor. I had a fit doctor at home, and I'm very worried about it, doctor.
I'm sorry to hear, but just quickly, I need to know your date of birth. Can you please tell me?
Doctor, it's 20 February
Thank you very much
1984.
for that information. Okay, thank you very much for that. You just mentioned that you had a fit at home. Can you please tell me briefly what happened, the whole story incident?
Well, doctor, I was watching TV with my wife, and
Mhm.
suddenly I had this a brief episode, which you can call as a fit, that I suddenly stopped and I couldn't move. My eyes
Mhm.
rolled upwards,
Mhm.
and
Mhm.
my wife was very surprised to see what happened to
Mhm.
me. And
Mhm.
it was just a minute of activity, and after
Mhm.
that, I don't know what happened,
Mhm.
because after 5 minutes, I don't remember
Oh.
what
Mhm.
went wrong.
Oh, it must be quite stressing for you and your family anyway.
Yeah, because we have never seen something like this happen.
Definitely, I will help you with that. Let me ask, is that happened first time? Is that happened before
Yes,
as
yes, doctor. It was the first time.
well? Okay, okay. So before that, you said you was watching TV. Have you noticed anything specific happened before that? Have you
Like
seen
what, doctor? What
nothing?
specific?
Okay. And during the incident, you remember everything what happened?
Doctor, I just remember watching the TV and nothing else.
No
Everything
worries.
I know is from my wife.
Oh, okay, so your wife told everything. Anybody else notice it
Oh
or anyone
no,
make video of it?
oh no, doctor.
Okay, okay, no problem. Okay, during the incident, by any chance, you bit your tongue? Oh,
Nothing like this, doctor.
okay. By any chance, you wet yourself or soiled yourself?
Yes, doctor. I wet myself and I was
Mhm.
having this fit. My
Oh,
wife told me,
oh,
because my
oh,
clothes were all wet
oh,
afterwards.
it's okay, no problem. So we'll find out. After that incident, do you remember like you was confused?
Yes, doctor. I was confused. I didn't remember what happened.
And how long actually it been now from that incident total?
Doctor, like 2 hours?
2 hours, okay. Okay, a few more questions about, I will just try to go from a very serious to less serious conditions, okay? So by any chance, do you feel like you're having spiking any temps in your body? Temperatures?
No,
No temperature. Any photo, problem with the light?
no,
No problem. Any pain in your neck?
nothing.
Okay. Any weakness of your arms or legs?
Felt a bit weak after the fit, but I don't
That,
know
that's
normal or
quite
not.
natural. But you're able to lift your arms and you can.
Yes,
Okay,
I can.
good to know that. Quite assuring. And anybody told you that you have any facial droop or like weakness on your face?
No, nothing like this.
Okay, okay, no problem. And thank you very much. No slurry speech as well.
No,
No slurry speech. Okay. So recently, any fever or flu in past 2 weeks?
I'm having this flu since one
Mhm.
week.
Okay, okay, okay. All right. So, while thinking about your general health, are you on any medications like blood thinners?
No, doctor.
By any chance, you bang your head? Have they told you that you bang your head?
No.
Okay. Any non-allergies?
No.
Okay. What do you do for a living?
Well, I work as a constructor, so I
Mhm.
work in buildings, and this is my work.
Okay, okay, no, okay, that's good. You work in the construction industry, good to know. Well, thinking about that, so you have it recently happened to you. Have you given a thought what could be the cause?
Doctor, as I told you, this is the first time we have seen something like this happening near
Okay,
us. So I what I
that
said.
makes sense. That makes. I'll come back to that. Any particular concern in your head at the moment?
No, maybe I had some problem with my brain or something.
Oh, okay, okay. Definitely, I will reflect back on that after finishing my assessment. So at this point, I would like to examine you, okay? And for that, I have to check the nerves of your face, your hands, your arms, and your legs. And I have to see your front and back of your eye. I'll check your vision, and I'll have to have a feel of your neck. I have to do some special test for that. And I might need, because you have got some positive finding, I might need to request a CT scan as well to make sure everything is okay. And is that be okay with you?
Okay, doctor.
Okay. Miss Lita, basically, after having a chat with you and after examining you, the symptoms which you told me seems like you had a fit, we normally call first seizure. Have you ever heard of that?
Yes, I've heard of it, but not more than that. So can you tell me a bit more about it?
Yeah, definitely. It's a part of jerky movement. So it's actually the 50% of people can have this one in around UK. But the good thing is that out of those 50%, the 50% people don't get it again. But we need to rule out epilepsy as well. So epilepsy is a condition in which the people have multiple seizure. Okay. But we'll make sure that we'll provide you everything what you need. At the moment, I need to refer you to the first clinic where they will do special blood test. Okay. Am I making sense to you?
Yes, doctor. What
Okay.
blood test?
They would do all other sorts of your electrolytes, we call it salts, and some special tests, and they would reassess you again, neurologist, and will see that and will tell you other things. For now, I would like to tell you, you need to not to worry much about that, but I would like to advise you not to drive going back home if you're not driving. It's
Okay,
okay
I have.
because until you're being told by the specialist not to drive, okay? Okay,
Okay.
Lita, one more thing. Thank you very much. One more thing, Lita, I would like to tell you, you need to keep an diary. And you mentioned that you work in the construction industry. Try to avoid going to the upper floors, okay? Because I'm a bit worried about that. It can cause you so that you would have a fit another time and may cause you some trouble for you. And
Okay.
one more safety netting advice I would like to give you. You tell your family, your wife, few of the things. We can give you a leaflet in which tell you the video, how to make a video with somebody getting fit. Okay, finish, time finish. I wanted to
Okay.
tell more, but I wanted to be calm down as well. Yes, guys. Ramesh, you give me score now.
So you did the history part right, and maybe you could have included headaches because
Headaches. Yes, okay. I didn't. Yeah,
and you didn't ask anything from the DESA part.
I skipped it myself because
Oh,
I skipped it myself because I was running out of time. I know that.
you cannot cover everything. That's
Yes, I
fine.
skipped myself this apart. I said because there is something very important to cover. So I don't want to do that. Because if I would have asked that diet, alcohol, everything that was at that point, I said, leave it. Because I would, this is what I try to be on the point because I knew that in first year I have to tell loads of things too. Yeah.
You missed the examination.
I didn't mention examination. I will have a look of your nerves of face, your arms, and everything. I didn't
Uh,
mention. I
okay,
didn't
I would have.
mention.
And the provisional diagnosis was good. I liked it, the fit and the seizure, and then maybe it can be
Uh-huh.
epilepsy. And it was good. Everything was fine.
No, but I feel like I should have one more minute in management part. So,
Safety
but
net
now I
was
understand. Now I understand, Ramesh, where you were struggling. It's not an easy station, definitely.
this
The
is never
epilepsy first
state
period.
whenever I to practice it as well, so I could have never covered it in time. So I'm okay with it. This is
Yeah,
quite a
yeah. Because I was thinking to tell you more that you need to trigger diary or something like that. Don't do this, this, this. But anyway, it's not an easy station. It's not an easy station. But I would like now, Saban is here and Dr. Noor, you just tell what things I missed and which part you think was uh, done better. Then after that, Mariam would be, is that okay, Ramesh, if you, because I know there's one more scenario to do. Mariam will do one scenario, then after that, we'll do that one. Is that okay with you? And I want you to debrief that scenario, what the Mariam would be doing. Okay.
okay. It's
Mariam,
fine.
is she's here or she's gone? Oh, she's here. Okay.
Yeah, I'm here.
Okay, so Mariam, one scenario I'll be doctor, and one scenario
Yeah.
you will be that would be from the respiratory part, okay?
Yeah, sure.
And we have done two. We discussed we will be doing two scenarios today, isn't it?
Well, I thought that we'll be doing the PCP one today. But
Okay,
I'll
okay,
be the doctor.
okay.
Yeah,
Yeah,
I'll be
yeah,
the
definitely,
doctor. Yeah.
definitely two scenarios. So one scenario you will do. I think I told you to do one.
No, so the TB one we did yesterday with Dr. Radwan, anyways.
You did the TB yesterday.
Yeah,
Okay.
yeah, yeah.
You
So I
done
did
TB.
the mesothelioma as a doctor, and then he did like a TB as a doctor. So we did like covered both of those
So you done the mesothelioma
as a doctor.
Okay, so PCP left. Okay,
Yeah.
so you will be doing that because that is very important scenario. And let's do it. Let's do it. Let's
sure.
do it. So I have the algorithm for the PCP as well.
Okay.
So let's do it. So I want Zubda, you want to give me score, or anyone want to give me score? Please give me. I don't care if you give me 0 as well. Please give. Why I'm telling you to give me score? Because I want you to know how you will be scored on data gathering part, which part you should be knowing. Because if you go through this way, then you'll get to know that total score is 12, not 16. Station is 16. The total score is 12 for data gathering, and for Ramesh, you're too good to give me for like 433. I don't like it. Myself, I'm not giving myself that much. In data gathering, I could have improved well in that one. So okay. Ramesh, you are the examiner at this time, and doctor is Mariam, and I am is that dodgy guy who got PCP. Okay, and my name is Michael Brown. I'm 23-year-old. I'm homeless and
Yeah.
so there's a different structures in this scenario. That's why examiner love this scenario, because in this scenario you will see three different. You will be introduced by another structure as well, refusal structure, and a few other things. So well done, guys. Let me put the timer on. After that, if you just give me.
I have a question.
Who? Yes, Zubda, yes, please ask.
I missed the yesterday session, so can you please brief about the scoring?
Yes, Zubda. What we can do, so we will be assigning you one mentor as well. So the whole idea of mentor is that any one of our tutor, maybe Mariam, maybe Ramesh, or maybe any one of us, they will contact you because you're the only one who didn't get any mentor. Hasham got mentor, Saban got mentor. Yes, whoever registered with us, they got mentor. So they would have 5 to 6 sessions, but you need to tell them that what session you missed, you can take another courses as well. And they would briefly summarize that thing as well with you. Okay. So I will ask one of the mentor, I will see that who is available. They will do 5 sessions all around before your exam with you. And you can send them messages, audio messages, they will reply. And even they would summarize whatever you missed. Okay. So don't worry about that. They would summarize. And myself will summarize at the end. Okay. Is that be okay with you? I'll come with the data gathering part and everything. And yes. So after this scenario, I'll summarize. Okay.
Okay, thank you.
Now, Ramesh is examiner, and from out of student, I want examiner as well. Okay. So let's begin now. I'm going to put on the timer, and this is the. You will hear the voice, and then after that, you will start. Begin.
Hello, good morning.
Hello, good morning.
My name is Dr. Mariam. I'm one of the junior doctors working in the GP surgery. Is this Michael?
Yeah, Michael.
All right. Can you please confirm your full name and age for me?
My name is Michael. I told you. Yeah, I just want to go home. Why don't I want to go home?
All right. Well, we can surely help you with that, but I just want to make sure that you're okay, and I need to ask a few questions. Will that be okay?
Okay.
All right. Can you please confirm your full name again and age for me?
Michael Brown, and I'm 24-year-old.
All right. Okay, Michael. So, you mentioned to me that you want to go home, right? So, could you please tell me why exactly you want to go home?
I will tell you anyway, but I just want to go home. You ask question, but you're asking, no problem.
All right, okay. So, can you please tell me what brought you here at the GP at the first place?
I'm coughing.
Okay, I can see that you're
It's
coughing.
so
I'm really
hard
sorry
to
for
breathe.
that. Okay. All right. Are you having some struggle with breathing as well?
Oh, yeah. Coughing. I'm coughing. Okay. I'm coughing up phlegm as well.
All right. Okay. Since how long has this been happening?
Hard to say, but maybe 3-4 weeks is going on.
All right. And do you mind me asking, have you been coughing any blood as well?
Not blood. I haven't seen any blood, but it's a
Okay.
white
Mm-hmm.
phlegm coming. I'm bringing white phlegm every time I'm coughing. A bit of.
Okay. And is it like, could you tell me the amount, like a cup or like a teaspoon?
Maybe a cup, a full cup.
All right. Okay. Okay. And also, have you noticed it getting worse over the period of time?
It's not getting worse, but
Mhm.
it's the same. It's same. But I need you need to fix it, doctor. Help
Oh,
me that so that
surely.
I know. Yeah.
Okay, I'm here to help you, and I'll try to find a solution for you. Okay. All right.
Yeah, doctor. My sometimes I can't breathe properly.
All right. Well, we'll be looking at your oxygen levels as well. All right, to make sure that
Okay.
everything's okay. Okay.
Okay.
All right. So is there
Oxygen
anything
saturation
else?
is 92.
Okay. Well, Michael, your oxygen levels are a bit low. So how about I give you a mask with oxygen so that you'll be able to breathe okay, all right?
Oh, it's okay, no problem, doctor. I don't need any mask. I'm okay. I'm breathing fine.
Well, I can see that you're saying that you're okay, but it's really important for your health, okay? Would you like
But
me?
doctor, I have to go home. Let me go home.
Sure. Sure, I'll be sending you home, but I need to make sure that
Doctor,
you're
I need to get
okay.
my thing. I'm telling you, I need to get my thing. I have to go home. I need to get my thing.
Or what do you mean by the thing?
I can't
Oh,
tell you. I can't tell you.
okay,
I can't tell
okay,
you, doctor. I can't tell you.
okay.
Let me go home.
I can see that you are a bit distressed. Just a few more things. I just want to make sure
I'm
that you're
telling you,
safe.
I not without that thing, and I'll be okay. I'll be fitting in front of you now. Why don't you let me go home?
Okay, I'll let you go home. All right? Okay? I'll let you go home. But I need to make sure that you're okay. That's important for your safety. I'm really sorry. I don't know, trying to be, judging or something. I just want to make sure that you're here and you're at a safe place, okay?
Uh,
All right?
what you gonna do, doctor, for me? What you gonna do? I
Okay.
told you I had to get my thing.
Okay. We'll sort something out. Okay? Just bear with me. I'll be right
What would
back.
you sort out? You will give me that thing.
Well, I can ask my seniors to come in and have a look at you, okay? And
Uh,
they'll help you in a better way, okay? Oh, but for now I need to ask you a few more questions. I'm really sorry.
Okay, ask question. What question you want to
All
ask?
right. Okay. So you mentioned to me that you're having this cough, and then you're asking me. So I'm gonna be a bit more intrusive, right? Will that be okay?
Okay.
Mm-hmm. Do you do any recreational drugs?
It's important to tell you.
Yes, it's really important for your health, I'm afraid.
Will you tell anyone?
Well, I just want to make sure that anything is going to stay just between us and the medical team, okay? So it's going to stay confidential. You can trust me.
Okay. Yes, I do take heroin.
Okay, since how long has this been happening?
It's a quite long, doctor. I just need to get it. You just need to
Okay.
get it. I
All
need to go
right.
and take it.
All right, sure. Now you've told me, so I've got the idea where it's coming from, okay? Just a few more things, just bear with me. So you mentioned to me that you've been taking drugs for quite some time. So are you using the same, like, do you share the needles?
I don't know about that.
Okay, all right. Have you got any family history of any medical illness?
Doctor, I'm homeless. Doctor,
Okay.
I don't have any family at all. I'm homeless.
Okay, I'm so sorry. I'm just going to quickly examine you, okay? Will that be fine? I'll be taking your observations again, and I'm going to make sure that I examine your chest. Will that be fine?
Okay.
All right. Well,
Bilateral crabs, saturation low, fever. Patient is scoring 3 or 4 on news.
okay, all right. Well, Michael, the thing is that you've been telling me that you've been using drugs for a really long time, and that potentially causes a person's defense system to be low. And what I'm suspecting might be causing is a serious type of an infection of your chest.
Infection.
Called, yeah. That will be called as pneumocystis pneumonia.
I don't want to know about that. I just need to get my thing. I have to get it now.
Well,
I have to go home.
Well, I'm so sorry, but that's important that if we'll not be able to treat you now, okay,
Well,
we might lose you.
Why don't you let me go home now that I get it and I'll get it and I'll come back?
Well, the thing is that at this point, your saturations are a bit low as well, and we cannot let you let you go home. That's not
You can't. How you can't let me go home? I come myself. I go myself. So why
Well,
don't you let
then-
me go home?
well, the thing is that it will risk your life, and we don't want that.
But you can't stop me staying there.
Well, surely.
You can't stop me. Let's see who gonna stop me. I'm gonna go.
Okay, I'm gonna ask my seniors to come in and have a chat with you. Will that be comfortable?
Okay.
All right, thank you. Oh God, I never expected this kind of a thing, because I was like, it was,
So let me tell you.
Oh,
Yes, it will be this like, but there are few tips and tricks which if you would have followed,
yeah.
you have managed that. But anyway, good consultation. You tried.
Oh
but
God, no.
I want to.
Well, I was like, I didn't want to give up in between, so I had to make it through anyways.
You will act same. First, let me discuss the approach. First, let's take
Sure.
the Ramesh. Ramesh, what do you say about this consultation? I want to listen from Ramesh. And Zabda, if you have anything to say, you can say that. Dr. Chima. Saban, you're not participating at all, Saban. Saban is not here. Okay, no problem. Yes, Saban is here, but you need to speak as well. What do you say about this consultation? Yes. What do you think can be improved on? And before listening to Ramesh, Mariam, you tell yourself where you were struggling.
Well, Saban has been generous by saying it was excellent, it was not. The
Really?
approach it says
You would say
yeah, so,
you would say the simulator was shit. You can say that.
no.
You
Well,
can
it
say
was
that.
really hard for me. It was really hard because I was not
If the
expecting
one would
this
have
kind
been
of
simulating,
refusal.
he would have been simulating very hard as well, because this scenario passing score is
Yeah.
very low.
Yeah. And generally, I did come across this scenario in one of my mocks, I remember, but it was kind of straightforward one in which the whole history was negative, just the cough, and then the hint lied in the homeless part, and then you have to ask the sexual part of the history. So there are two types of the histories. I never knew it would come with the refusal patient as well.
Yes,
So as
yes,
a
well
simulator,
done.
you were excellent, obviously.
In this
And
scenario, all three things might be that time when you got it, that was not
Yeah.
simulated the way.
Yeah.
I'll tell you how it would be simulated, because
Yeah,
sometimes
obviously,
when you're
yeah.
practicing with your partner,
Mm-hmm.
sometimes you have to know that you're practicing right.
Yeah,
Because
true.
in this scenario, it is what? Refusal structure, drugs history, sexual history.
Yeah.
What loads of things to do in this scenario. It's
Yeah.
not a doable state of a scenario.
True.
Okay. Now,
Yeah.
I'll ask Ramesh, what do you think? How it could have done better?
Well, you were quite hard on the doctor.
I was
And
not.
Dr.
Because
Dr.
doctor didn't ask the question. Doctor is not giving me the thing. If doctor would have said, I will give you something which is different to that methadone, I would have gone down. But
Well,
my doctor
I
didn't mention.
wasn't sure that am I supposed to give or not. So
I remember.
I'll speak to that. I'll speak of. Musairat, I will do this scenario. I'll tell you little tricks. Confidentiality. Bring confidentiality in the start.
Mhm.
You had to do that. At some point, I noticed that you got irritated of me and you got offended. The thing is, if you got offended, the paid actor has been paid. So, and you have been. So, in any scenario in your real life as well, you will see very tough patients. You will see very tough simulators. That is made that way. The whole idea is that you don't get offended. You get oversweet.
Mhm.
In LGBT scenarios, the people will get angry. You get oversweet. I'll try to be oversweet if you do it. I want you to be very strict like I was, but I'll tell you few codes, because GMC or examiner want to tell you that how you would convince anyone, like someone. If someone is on the drugs abuse, they need drugs. They're not going to listen to you. I've seen loads of patients when they would say, I'm going to be fitting in front of you. If not, you're not going to give me this. Then we as a doctor, I have done this simulation quite many times in different academies. Trust me.
I remember teaching us this as well, and you told us that you have to go through the carrot and stick approach.
Yeah, that was a definitely it's a refusal thing. Or I'll come to that as well. I'll try to cover everything.
Okay.
So Ramesh, basically, I will come to that, Mariam. You tried well, but the thing is, the structure itself contains few things which need to be followed. So now, Ramesh, you want to add anything? What you think that could have?
Well, Dr. Mariam was doing really good. She was trying really hard to bring you to the point to stay in the hospital and get the treatment. But obviously, she had to give something alternative to the heroin.
Yeah, she
So
didn't
that
give me. She didn't talk about
Hmm.
methadone or something antidote for that.
Mhm.
So
So like if we see a patient who is very keen on smoking and he says that, oh, I want to smoke in the hospital, so we find
Yeah.
some not smoke some smoking area for the patient so that he might stay in the hospital. So this scenario also goes this way, like if the patient is very much willing to take heroin, so and we want him to get the treatment, so we offer him something that he might stay in the hospital and get the required treatment, and
Withdrawal
then we can.
symptoms. So if he's getting withdrawal symptoms, we need to give them something different. We'll give you something different for your drug
Okay.
cessation or something like that.
Okay.
Okay. So that's fine. Let's quickly discuss approach. I'm going to share my screen and then I'll tell you what approach need to be followed. Okay. So let's quickly share my screen now.